The actress Mindy Kaling once said, "My daughter told me I look like a piñata," and I take that as the highest compliment. Welcome to the Mummafesto, the podcast where parenting and politics combine. Joining me this week is the author Daisie Lane. Daisie is the founder of the Lockdown Mama community and author of Mothers in Lockdown, a collection of stories from mothers sharing their experiences of pregnancy, birth and postpartum during the global pandemic. The book collates over 150 honest accounts of mothering amid the lockdown, a time when 600,000 babies were born in the United Kingdom. Daisie, welcome to the Mummafesto. Daisie, thank you so much for joining us this week on the Mummafesto. You and I are in a very odd club because we both had kids during lockdown, which was a very strange thing to do. But talk us through what that meant for you.
Yes, it's a strange club to be in, definitely. It's I had my daughter in June 2020. So when did you have your baby, Stella?
I had my daughter in November 2019.
19. So yeah. So I was we were still in the first lockdown when I had my daughter. And I found it to be extremely difficult. I'd spent most of the third trimester of my pregnancy in lockdown, and those restrictions were still present when I gave birth and into some of the postnatal period as well. So I was induced alone, I laboured alone until my husband was allowed to join me when I reached a certain stage of active labour. I know this was a rule in many hospitals at the time. But sadly, I already felt pretty broken by the time he arrived. I was extremely vulnerable, as anyone is when they're in labour. But I didn't have my support system, my person, my advocate. And so I went to birth my baby already very anxious. And what I think affected me the most, and what will stay with me the most, is the postnatal period. After my little girl was born, she and I had to stay in hospital for a further 5 or 6 days. She was premature, so she just needed a bit of extra support. And in that time, the restrictions that were in place within maternity care pretty much broke me. I couldn't have a single visitor, not for a second, not even my husband. So I just experienced a traumatic birth. I was very much in shock, baby premature and unexpected. I was extremely sleep deprived. I was a first-time mum with no clue what I was doing, and my husband was rushed out of the hospital, and I didn't see him again until the following week. So I've talked about this a lot, but those days were some of the hardest of my life, and that's difficult to say because they were the first few days of my baby's life, and it's supposed to be this beautiful, magical time, but in some respects they were the worst of mine. And yeah, I was so lonely and so frightened. I really needed that support, both physically and emotionally. Even just, half an hour a day would have changed the game for me. But instead, it was a different story. I just remember spending most of it crying. Obviously, the staff around me were struggling. They were doing their absolute best, but it was a really frightening time in a hospital setting. And that was palpable. You could really sense that. And midwives were being, pulled onto COVID wards, and it was very chaotic. And a lot of the supportive services that are usually there and available, breastfeeding support, for example, was not there. And my postnatal care was pretty much non-existent. So that was kind of my experience, just in a very short space of time, just those few days. And in those few days, I watched myself deteriorate daily. I was delirious. I knew I wasn't being the mother I wanted to be because I wasn't able to be whilst I was alone and isolated. And so I left the hospital a different person. it sort of took something from me in those first few days, and I'd really hit a low that I'd never been to before. And so when I brought my baby home, which again should have been this magical time, it was actually very sad, because how do you sort of reach such a low and then spring back up from it and just immerse yourself in this magic of motherhood? You can't. You can pretend, and to an extent that's what I did, and I really tried, but I had been plunged into motherhood on the back foot, really, with that start, as so many other mothers were,
I think
and the
that's what's
bottom
so,
line was,
I was to say, I think that's what's so powerful about what you're saying, is because the very first time you have a child, it is overwhelming at the best of times. Obviously, if you have a child who requires additional support like you did, that's also very overwhelming. To try and cope with that on your own, and in a world where it wasn't clear what would happen next. I had my child before yours, so I had a child before the lockdown restrictions came in, but they came in very quickly when she was
yeah,
very young. And I have such an overwhelming memory of my mum coming to my house and me knowing that restrictions were coming and therefore she wouldn't be
yeah,
able to help me. And even at that point, a bit further on, I still didn't really know what I was doing. And I actually had to leave my mum with my baby and go and cry for a bit, because I thought, I don't know when you'll be able to come and help me again. And this is overwhelming as it is. And I think there is a whole generation of mums and dads who had children during lockdown and had a completely different experience of what that overwhelming experience of having a child looks like.
yeah,
And you've
absolutely.
talked to a lot of other mothers in that position, haven't you?
Yeah, so I speak a lot I write about motherhood,
Mm.
and I share a lot of that online. But when I'd speak about the impact of having a baby in lockdown, I'd get inundated. I'd get hundreds and
Mm.
hundreds and hundreds of messages. And I kind of thought, hold on a minute, there's a lot of people here with a lot of trauma, who are very angry, who want to talk about this. A lot of this resurfaced again when we kind of found out about some of the rule breaking and the parties that were going on at the same time as many of us were experiencing this trauma. So there was a real sense of collective anger amongst mothers. And, I get these messages where it was clearly visibly pouring out of people. It was like it had been pent up for so long while we were all abiding by the rules and we were kind of in this survival mode. And then when restrictions began to ease, we kind of let out a breath and just all this trauma came pouring out. So yes, so sort of out of the ashes of lockdown, I created an online community for lockdown mums. I approached Arts Council England, who are funded by the National Lottery, with an idea of a project to encourage mothers to write about their experience. I'm a big believer in using writing as a therapeutic tool. So the goal was to try and work through some of this trauma that we'd all endured, which was leaving us with a maternal mental health crisis. And yeah, they supported the project. They granted me some funding. And so from there, I had a fire in my belly then, and it gave me this sense of purpose to do something from something so sad. So I put the word out, attention, lockdown mums, and we did Zoom sessions, lots of different things. We worked through a lot of stuff, and I eventually encouraged them to write their stories, basically. And I kind of promised that we would publish them in a book. There were no rules, just a word limit. Just tell us how your motherhood journey has been impacted by the pandemic. And my aim, what I wanted to do was kind of solidify these experiences in history forever, and give mothers that voice that so many of them felt was taken away at a time where they really needed to be heard. And the response to the project was overwhelming.
Mm.
It was way bigger than I ever thought it would be. And it was a real journey of healing, not just for these women, but for myself too. Knowing that so many of us were struggling because of the same reasons, and so many of the threads in our stories were so similar.
How did you feel that the second lockdown then affected that group of people?
I mean, we've kind of got a mix of people in. Some of them had young babies by that point, but some of them gave birth in the second lockdown. So we kind of had mothers at all different stages. But it's exactly the same, regardless of when it was, because it was, speaking for myself as well, I'd had this shred of normality. I was given kind of this, I was dangled a carrot, like, oh, your mom can be with you now. Your mom can hold your baby. And I'd kind of just got used to that. And then it was taken away again, and I had to adjust back to this sort of isolation. And so, yeah, this went into 2021, like you said, with the second lockdown. And yeah, so we've kind of got this beautiful connection and understanding, this community that comes from something so sad. And that kind of culminates in the book. So this July just gone, I published the book called Motherhood in Lockdown, and it's the stories of 150 of those women whose pregnancy, birth, or postpartum were impacted by the pandemic. And it's one of my most proudest achievements. It's a devastating book, but it really shows the power of human connection and also the strength of mothers in one of the most challenging periods in modern history. And the book also interrogates the restrictions within maternity services, and it shows the impact 4 years on. We're still talking about this now, and it shows exactly why this must never happen again.
What sort of impact would you say has continued on?
For myself personally, I was diagnosed with postnatal depression, and then from there, a few months on, PTSD, which to this day I'm still affected by. I was put on medication, I had therapy. It took a lot of processing to heal, and I'm still not there. And my story is not one on its own. This is just, I'm hearing it time and time and time again. It took me, I'm currently pregnant with baby number 2.
Oh, congratulations.
Thank you very much. I'm due to pop at any second. So
okay, well, we'll try not to excite you then.
if you hear a trickle of water at any point. But it took me 4 years to contemplate the conversation of having a second child. And I know many women still can't get there and might not ever. So the lasting effects are real.
And how does it feel this time round when actually you can access some of those support services, going into maternity wards, going into antenatal classes?
Yeah,
how does that feel?
It's a very different experience in pregnancy in an unrestricted world. I was given only the other day, actually, by my consultant, a sheet of paper with the maternity unit visiting times on, in preparation for me being there. And I read it and I cried. It was like, 9 a.m. till 9 p.m, 2 birth partners allowed, visitors, your own children, this, that, and the other. And I kept reading it over and over again, and I was like, this must be a mistake, because I couldn't, it's really opened my eyes to what I should have had, what so many of us should have had. And so it makes more sense to me now also why I struggled so much, because it's highlighting what we missed out on. My mum has said to me, I can come and help out, we'll do this, I can stay over. And I'm like, what? because my mum couldn't, like yourself, what you experienced with your mum. My mum couldn't hold my baby. Last time it was all window visits, and she couldn't help me. And I think, yeah, it's just, so there's a loveliness to this pregnancy because I'm able to rewrite a lot of the things
that happened to you during
that
lockdown.
happened. Yeah, but it does also bring to the surface that sadness of what I did miss out on with my first baby.
I think there are a whole generation of mums who went through lockdown, whether they had their children on their own, whether they experienced trauma in hospitals, or whether in those first couple of months trying to look after a child on your own without any support networks, or even in the second lockdown. I had my second child in the second lockdown.
Yeah.
Time and time again, even as a pregnant woman in some of those meetings in government, we were not on the agenda. Those mums were not particularly thought about or concerned about because it was a pandemic crisis.
Yes.
And I think there is a story to be told, which I think your work does so powerfully, about that group of women and their partners and the long-term implications. I do think there are some really interesting implications, and I'd love your thoughts on this, and maybe people listening will have views as well, that having had to do motherhood differently, having not been able not just to have people with you at birth, but maybe go to classes or be around other women. I mean, the spectre of, the NCT groups and the baby and bump groups that nobody was able to participate in, or I remember trying to do a baby class online, which was like my daughter just sat looking at me, and even then she was just looking at me with like, mother, just stop. Because I was so concerned about, well, I want to try and to make this as normal as possible for her, even if I'm scared about what the pandemic might mean. But I think there's a whole interesting experience that many of those families had about doing parenting differently because you had to, because you couldn't access support networks. I also think there's a lot of partners who were probably more present with their children than they perhaps would have been because they couldn't go to work, so they were working from home. I'd be really interested in your thoughts on that and what's coming out of the conversations you're having with people about perhaps some of the unintended outcomes of
Positives,
being so together all the time.
Yeah, there were many positives. I experienced them myself. My husband was at home. He worked from home, and he was there. It was all a last minute setup. He was there in the living room at this makeshift desk while I was on the sofa with the newborn. And there are times I look back to that. I look back on them with a smile, because he was able to watch our daughter grow. Otherwise, he wouldn't have seen that. He'd have been, in the office and here, there, and everywhere. And so I hear that a lot. There was a lot of positives. And my little girl has just started school in September, so she's 4 now. And so we're seeing those lockdown babies come through now into school, and having the conversations with the other parents. We're all these, this club that you mentioned of lockdown moms, and we were all so fearful of, are our children going to be impacted forever by this? Are they going to be behind because they haven't had the experiences that they should have had? And, things we were also worried about. And, we were watching our kids go through these doors just determined and strong, and they're absolutely fine. So, I kind of realised that I think it's important to say that most of us understood the need for restrictions too, and respected them. And if history were to repeat itself, I would abide by them again. However, the issue was the bigger picture. Maternity restrictions were some of the harshest and longest lasting in the UK, and most of the time that did not make sense. Less than a month after I gave birth, pubs were permitted to reopen, for example. A few weeks later, we were then financially incentivised to eat out to help out. And still at that point, mothers were giving birth alone. And they were long into 2021. And there was kind of no sense of urgency in rectifying this or making the guidance more robust or clear. maternity restrictions did not seem to be given the same focus as anything that meant economic gain or social pursuits with particular bias towards men. And we kind of really needed to recognise the nuances within maternity care. So, for example, by restricting visitors and that supportive structure that visitors bring with them, the tasks that they can help with, all now fell to the mother. Some
It
of whom
also meant I was
surgery.
I was very traumatized by having struggled to have children for a long time,
Mm,
and with my second pregnancy, because I'd had particularly negative experiences of having sonograms when then I was told that a baby had died. I always struggled to go and have the scans.
yeah,
It was never a
yeah,
happy experience for me until I
no,
came out and everything was okay. And during the second lockdown, I had some what you would call full, frank, and free discussions with sonographers who said, no, your partner can't come in with you, because I knew I couldn't go in and have the scan
yes,
if there wasn't somebody
yeah,
with me, because it was just too frightening. And it
yeah,
was a very difficult conversation because I understood, as you say, you understand the restrictions and why they were there, and you also know yourself. And I think one of the things I was very conscious as, both, as I say, a pregnant woman, but also a member of parliament, in some of the conversations at a national level, was that nobody was thinking about that group of mums.
yes,
And we saw it in terms of the vaccine access, and we saw it in terms of, as you say, the restrictions that just carried on, and
hmm
the presumption that it didn't matter what was happening to that woman, COVID mattered more. So I
yeah,
think there were a lot of us who struggled, whether it was in the first or the second lockdown, with those restrictions, because it didn't allow us to enjoy our pregnancies.
absolutely. Yeah, we cannot apply this kind of blanket approach, this one size fits all to maternity care, because we need to weigh up the risks to mental health in the long term. And that needs to be taken seriously. And, there were, of course, restrictions across, if we look at the entire hospital at that time, uh, other patients were similarly experiencing, outside of maternity care, were experiencing pain and sleep deprivation. And, they were still restricted, couldn't have visitors and things like that. But only in maternity care is that patient solely responsible for a secondary vulnerable human being at the same time. So the restrictions kind of gave no thought to that. So this is where we need to recognise these nuances within maternity care. And, the most profound moments of one's life, birth and death. And that was where things went so wrong. I feel, people
Mm.
died alone in hospital and women were birthing alone in hospital. And these are significant events that have a profound impact. And it's just, with the COVID inquiry, we're hearing evidence at the moment of how these maternity services were impacted. We're still talking about it 4 years on. I'm here talking about it 4 years on because we need to interrogate what went wrong.
Yeah.
And God forbid, should it happen again,
I
we
think it's
need to learn from it.
understanding the role that second person plays, as you say,
Yeah,
whether in birth or indeed in death, in being with somebody. I always found it mad that, say, my partner was allowed into the maternity and the antenatal wards, but not into the consultations with me, because
yeah,
I thought, if there's a risk of infection, surely it's coming through the door. And I do think there's a broader question here that public policy needs to answer. And this podcast was very much about all those conversations that people are having in everyday life, but maybe in politics we're not hearing, and yet influence outcomes.
yeah.
What was it about that group of patients that meant that nobody was thinking about the support networks that they needed in that crisis point? How can we avoid that in future? Because it had, as your story shows, very long-term consequences for people.
Yes, absolutely. And so many of us, some of the stories in the book, I've kind of said there were a lot of threads throughout all of the stories that are very similar, but so many of us changed the entire course of our own care and our own recovery. We put our own health and well-being on the line in an attempt to take back some control. So We delayed or avoided going into hospital when we should have, so that we could stay at home with someone for longer. We asked for more internal examinations because that was our only way to determine how far along we were in labour. So it was our only way to gauge when our partner could be with us. We asked for more caesareans. We asked for more home births to try to eliminate the risk of being alone in hospital. And then even after babies were born, we discharged ourselves before being medically fit because we wanted to get home to where support was present. So we were completely changing the course of our recovery. We were really dancing with risk because we were so desperate just to have someone. And there are a lot of these stories in the book, but you touched upon it. So many mothers had to go through losing their babies alone, and then the news to their partner, waiting, hopeful, on the car park. We had many parents whose babies were in NICU, and only one parent was allowed to visit, and it was juggling that. We had one lady who would walk a 6-mile round trip every day to deliver breast milk to her baby in NICU because COVID was rife on public transport, and she was so frightened to go that way. We had a lady who could not access normal postnatal care, so she had to show her episiotomy stitches to a doctor via a video call. Like, just the most, so many things in this book that really make you go, oh my God, yeah, that happened. And there are sadly women who wanted to end their lives because of how they felt. And so, with suicide being the leading cause of maternal death in the first year postnatally, which is a horrible sentence to say, it's important that we prioritise the mental health of mothers. It's surely a matter of national importance, but it didn't seem to be at the time.
I just think from my own experience of talking to some of the most senior people involved, the question about that cohort of patients hadn't even entered the conversation. There was a blankness when it came to, I did a lot of work at the time on the vaccine access, and there was just, it wasn't a rejection. It was just literally like pregnant women were kind of the last in the queue of people to add to the list of things to think about, and they would get to you eventually. And we saw the consequences. But as you say, we are now 4 years on, and hopefully our children don't expect. I mean, I say if they've missed out on the NCT kind of meetups, maybe, or the first lot of those baby classes where you think, I have no idea what I'm doing. Does anybody else know what we're doing with this pair of maracas? But this podcast is called the Mummafesto. It's obviously about what would we like to see in a manifesto. We've had an election now, so we're into a new government. If there was one thing coming from your experience of this that you would like to see Parliament and policymakers learning, what would it be?
I'm going to go a bit old school here. I would do something that's already been done, but was decimated by the Conservative government. So I'm looking back to New Labour government here. I would urgently.
That is very retro.
Yeah. Well, 90s baby here. I would urgently open Sure Start style centres across the UK, beginning with the most vulnerable communities and continuing until there was at least one in every town. And just as they did before, there would be a one-stop shop for mothers and babies, regardless of income, regardless of circumstance or background. You can push the pram there and get feeding support, maternal mental health support, parenting advice and classes, postnatal checks, baby groups, mom groups, an even more modernised, revamped version now, taking into consideration the presence of social media now and the impact that pressure can have on mothers. But we know the positive impact that these facilities had. We know the economical benefit. It delivered benefits far greater than the cost. And it helped mothers and families massively. And that's something that I feel is really missing. And so, yes, that would be a priority of mine.
It is one of the sadnesses I feel actually post the lockdown 4 years on, that moment where a lot of parents came together and went, this is ridiculous. The government's talking about investing in potholes, but not talking about parenting. Right, never again, especially as they learned to homeschool and realised how much work that was. There was a kind of call to do things differently and to learn from that experience of making an entire cohort of people have children on their own, be parents on their own, cope with things like maternal depression on their own. That actually it's almost like that's been forgotten as a lesson, that it was so very difficult for people, but it was an opportunity to do this all in a very different way. That's what I think is so powerful about what your book has captured, and what I hope people listening to this will ask themselves, because if all we learn from this is that it's quite useful to be able to do Zoom meetings now you're at work, that isn't really, I think, the legacy that any of us who went through that experience would want.
Absolutely.
Sure Start would be an incredible thing to return to, and having those networks. I would hope, though, that there wouldn't be any more of those weird classes, because when I did get to do some of those weird classes, I did think, I'm quite glad I didn't do very many of these myself.
What classes did you do?
I did try to do some of the baby sensory stuff. So I do get very triggered when I hear that song about Hello Sunshine, and I sort of that was the kind of earworm that went round and round in my ear. Yeah. But Daisy, I think it's so powerful for you to bring those voices together, and I hope anybody who's listening to this who was in that experience will also feel that they should talk about it, because, as you say, it's so important that we don't forget that group and forget what was asked of people during a crisis, that in a crisis something as vulnerable and as life-changing as having children was jettisoned in favour of a conversation about how much we're going to spend to revamp the potholes in the roads.
Exactly, yeah.
Thank you so much for joining us on the Mummafesto, Daisy. We'll put a link to your book if anybody's listening to this and they want to read it and maybe even contribute to your community, and be so excited to hear about the birth of your second child. And I hope and I wish that you have a successful birth.
Thank you very much.
And you have all that lovely time. I'm afraid I do think the sleep deprivation is universal. I don't think there's anything any of us could do.
No, I'm afraid my baby's going to be very perfect this time.
Perfect sleepers.
Going to sleep. Yeah, she's going to sleep all of the time.
Yeah, I always remember hoping and seeing, because say when you were on your own, you thought, well, gosh, is this how it's meant to be? And I watched a lot of those Instagram videos and tried all the different things and still ended up with a baby asleep on me.
Everybody keeps saying to me, this one is definitely going to be the opposite. Your second one is always the opposite of the first one. So for me, that means this baby is going to be an absolute dream. So that's what I'm putting out into the universe.
We are rooting for you, Daisy.
Rooting
for you.
Thanks, Stella. It's been lovely to talk to you.
I hope you found listening to Daisy's story about being a mum during lockdown powerful. I don't think I can say it was a fun experience. I do think it's really important that in public policy we don't forget that there's an entire generation of babies who experience people wearing masks as a commonplace thing to do, or whose parents were traumatised by having to go through parenthood on their own, indeed difficult births and that postpartum period. If you are one of those people, please do check out Daisy's book. Please do get in touch with her, and please do let your MP know that never again should we forget about pregnant mothers and their partners, even when there's a crisis such as a pandemic. I hope you've enjoyed listening to this week's Mummafesto. Please do listen to the next one.